and welcome to the December 2023 education updates. So this month I want to start with the quote, "The great aim of education is not knowledge, but action." And this is very meaningful to nursing or being an EMT or paramedic because it's not just the education that we get from learning things, but how we put that education into action. How do we translate that into care of patients? So kind of makes sense, and it applies to our work as healthcare providers. Some new staff that we are welcoming for Broomfield. Jen, she's one of our PRN RNs that just joined us back in November. And then Corey Beamer is a traveler on nights. For Long Speak, we do not have any new hires in November, but we do have a couple that are coming up in December. Some housekeeping stuff, make sure you sign up for LPH Trauma Advanced Skills Lab. This is LPH only. We do have 2 more offerings coming up, January and April. So make sure if you haven't done that, please do so. This is a requirement for all staff, RNs, EMTs, and paramedics. BFH LPH Preceptor Committee, we have this every month. Unfortunately, November we had to cancel because of a bunch of PTO that was happening. And again, unfortunately, we have to cancel in December again because of PTO. We are going to be resuming them in January, so please don't lose faith. We are going to resume those, so please be on the lookout for those. If you are a preceptor, you should already have an invite for this. If you do not have an invite, you are not a preceptor and you'd like to join because you're curious about becoming a preceptor, reach out to me and I'll get you an invite. And we look forward to seeing you guys. We have a lot of good information that helps us prepare and strengthen us as preceptors. More housekeeping stuff, annual competency assessment plan. This is a document that was created for all of you RNs, EMTs, and paramedics to kind of utilize as a guide throughout the year to show you what education you are required to do. This is something that you need to present at the end of the year, the fiscal year, during your career conversations as proof of work of your education. So please make sure you are utilizing this document. This document can be found under the education folder in your units teams page. So BFH right there. It's kind of small, you might not be able to see, but BFH education folder and then LPH education folder and navigate to annual competency assessment plan. Advanced CPI, just a reminder that if you are signing up for CPI, and I should stop calling it Advanced CPI because truly it's CPI Advanced, this is what you should be searching for in ULearn, CPI Advanced. It actually has a longer title now because it's including restraint competency as well, but as long as you type in CPI Advanced, it should pop up. So make sure you are signing up for that class and just be mindful that this is a longer class and now has an annual requirement. So be aware of that, plan ahead, and make sure you sign up for CPI Advanced, not Basic. We no longer do Basic as of October. Education calendar. This is something that I've created for all of you guys to kind of see some of the education that's coming up if you want to plan accordingly. This calendar lives in the education folder for both of the units, BFH and LPH. These are links, so if you see some education that you might be interested in, you just click on that link and it takes you to the registration page. In December, we got a few education opportunities that I'll be going over here in a minute. So all you got to do is go to this calendar, click on those links, and it'll take you straight to the registration page, or it'll take you to the Teams meeting page where you can join the meeting directly. So be on the lookout for some of that education. So going into the education for December, ketamine for acute pain. This is something that we are seeing a lot more often being ordered by physicians or providers in general. So this has been occurring at LPH. Haven't seen it at BFH too much yet, but it is a possibility. So just kind of information for everyone here. So ketamine, we very often see ketamine for conscious sedation or during intubation, stuff like that. It can be given for acute pain, and we have been seeing that a lot more. The big caveat with that is this is not a push medication when given for acute pain. This is a drip, so make sure you look at your administration instructions. So for in this case, giving the order is for 20 milligrams of ketamine. This needs to be placed in a 25 ml normal saline bag and given over 10 to 15 minutes. So it has to be given by drip. If you're ever in doubt about a medication, if you get an order and like, I'm just not sure what the administration of that medication is, always defer to your EMR. Your EMR will have the administration instructions in there. And if it doesn't for some reason, call pharmacy. They are always there and they can always assist in telling you what needs to happen with that medication. So just a reminder, be on the lookout for that. check your EMR, make sure you are administering the medication correctly. Virtual Journal Club, so this is a requirement for all RNs. It's not a requirement for EMTs and paramedics, but highly encouraged. This is great information. So if you want to take part in this, this is amazing. Go for it. There is a Virtual Journal Club that's coming up in December, hosted by Brenda, one of our charge nurses at BFH. So this is actually a really timely and a good one because she is presenting an article on the effects of hypothermia in the emergency department on the outcome on trauma patients. So if you haven't done so yet, please go to your Teams page and search for UC Health Virtual Journal Club. That will populate with the Teams page for the Journal Club, and it will give you month by month offerings for each month. And you can choose which one really applies to you or you have an interest in, and then you can complete that Journal Club. What that entails is you read the article and you have some discussion provoking questions, as you can see on the right here. You have to create a post on Teams answering these questions, and then you have to respond to one other person. So it's kind of like if you've ever taken online courses and you have those discussions every week and you have to post your initial post and then you have to respond to somebody. That's kind of like that. And then you do your appraisal form and you get a 0.5 CE and CPD contact hour for that. So make sure you are doing your virtual journal club if you are an RN as an annual requirement. All right, so this is for BFH and LPH, more so BFH because BFH is in their joint commission window. They should be here any day. If not today, then probably next week. But regardless, good information for both facilities. Sedation narration or sedation narrator. So I released recently this education. I call it a one pager, but really, truly, it's 2 pages. It's hard to fit all that information on one page. This was released to BFH because I'm trying to track completion because of that Joint Commission window. I will be releasing this to LPH soon as well, so everybody will have it. Make sure you guys review this 2-page one-pager. It has a lot of good information about how you should be utilizing the sedation narrator, what are some of the things on there, how it flows and all that stuff, and what documentation is really required in there. Once you review these 2 pages here, there's a QR code. It's kind of small on here, so you might not be able to scan it, but there's also a link here. This will take you to a quiz that's gonna do a knowledge check and also provide attestation that you've completed this. So if you haven't done so, please make sure you complete this at BFH, and then at LPH, be on the lookout for this. More Joint Commission preparation stuff. So point of use instrument cleaning. This has been a hot topic. We've noticed in North, South, and Metro region, wherever Joint Commission has been so far, they've been asking about this. So we want to review this. We reviewed this back in a few months ago for LPH when they were in their window. So I'm bringing this back up again. Why do we have a POU process, point of use process? This helps prolong the life of the instruments. Moist instruments are easier to clean thoroughly, so that way you don't have that solidifying debris on there. Soil promotes biofilm, which can be resistant to cleaning. So if we don't keep the instrument moist, it creates that biofilm, and it's really hard to clean them. And then what is the goal of point of use and decontamination? And again, that's to remove that biofilm, make the instrument safe to handle, promote timely cleaning, and return to service. Do I need to wear PPE for a point of use cleaning? And the answer to that is yes. You have to wear PPE, and that includes gloves, goggles, and gown. That is because the debris can be flung from the instrument as you're cleaning it. You can have some splashback or something like that. So make sure you protect your eyes, protect your clothing, protect your body from any exposure to bodily fluids. And then the big takeaway from this is I don't want you guys to memorize the process. If for some reason you want to, go for it. It's cool. But you don't have to memorize the process of how to do this. Just know where to find the information for it. So know that in the clean utility room or wherever your red bin is stored, there should be instructions on how to do this process. So what does the process look like? The process is you take your red bin and you bring it to the patient room. You do not take instruments and bring it to the clean utility or soil utility to place them in the red bin. You never want to transport instruments outside of the bin if they're soiled. So you take that red bin, you bring it to your room, you perform hand hygiene and don your PPE, you moisten a cloth or gauze with either tap water or sterile water. And this is super important, not saline. You wipe down instruments to remove bioburden using a wet cloth or gauze, moistened with water, not saline, because saline can degrade the instruments. It causes pitting and then it compromises the instrument, and that instrument is trash. So flush any inlets, outlets with sterile water, unhinge, open all instruments and place an approved rigid transport container. That is your red bin. Remove your PPE and perform hand hygiene. Cover the bin with the lid and latch. Remove and discard the clean label, the green label that's on top of the lid, and that's going to expose the biohazard label, which is orange. And then you take that bin and you transport it to your soil utility room. Again, when in doubt, make sure you know where the flyer for that is, and that's going to be in the dirty utility. Once you get to the soil utility room, you can perform hand hygiene again. Well, you should perform hand hygiene again and don PPE. Open biohazard bin. Spray the instruments liberally with the pre-treatment spray. This is this pre-cleanse can that you see right here. Instruments must remain wet to prevent biofilm formation. We kind of talked about that earlier. Remove your PPE and perform hand hygiene. Cover the bin lid and latch, and leave the bin in a designated soil utility room for SPD to come pick it up. Depending on the facility, you might have to call SPD and let them know because they don't have scheduled pickups, or they might have a scheduled routine where they come in at a certain hour and look if there's any bins that need to be taken and cleaned appropriately. Wipe the exterior of the bin with the approved hospital wipe, which is your purple wipes, to remove any debris from the outside of the bin as well. Next is the Pixis ES Go Live stuff. So BFH, we went live a couple weeks ago. Sounds like that Go Live went pretty smoothly. I haven't heard any issues. Thank you to all the super users that did the training and everyone that's completed their ULearn modules, because that really ensured that we had a smooth transition. And I think the system is going to work much better for us. It has really cool things that you can utilize in that system that we didn't have before. So for LPH, our go live is January. So we have identified our super users. Everyone should have their information on how to sign up for that super user class if you've been identified as one already. And then you should be seeing a bunch of ULearn modules assigned to you here soon. There's 8 modules in total. It looks overwhelming when you get that assigned. It's really not a lot. All those modules together, all 8 of them, took me about 40 minutes to complete. They're super short. They're about 3 to 6 minutes each. Very quick to complete. It's a video and then a simulation of how to do the actual process. So they're super quick. So please make sure you do all those ULearn modules. Super users, make sure you attend your training, and just like BFH, we'll have a very smooth transition to this new system. So December education offerings is something I started doing last month. I want to continue doing this because it kind of brings into the spotlight some of the education that's coming up in December or the upcoming month. So for December, on the 5th, we have our pediatric grand rounds, which will be cystic fibrosis from salty babies to modern adults. You can click this link to access that, or you can navigate to the education calendar. On the 8th, 11th, and 29th is our next CPI advanced courses. These are from Metro. I believe all these are Anschutz. None of these are at LPH. Unfortunately, I don't think we have an LPH offering in December. So you can click this link to access registration for that, or you can go to ULearn and just search for CPI Advanced. On the 14th, we have our next trauma overview course. This course is required once for everyone. So if you're a new hire or you've been with us for a while and you haven't taken this course yet, this is a requirement. You have to attend one of these. So make sure you sign up for, I think this is the only one that's offered right now. There will be more as our trauma team posts them in ULearn. So if you can, please attend this one on the 14th. There's the link right there if you want access registration for that, or you can just search for trauma overview in ULearn. On the 20th, we have our cold emergencies in the ED. This is a course that's offered through Anschutz, but it is virtual. If you want to attend that, that's a really cool CE, very timely again. Here's that link for that as well. On the 21st, from 12 to 1300, we have our trauma grand rounds. The next topic here is going to be management of traumatic injury during pregnancy. So very good information. These trauma grand rounds have been a hit. They have really good presentations there. There's a lot of good takeaways from that. If you're interested in that, please click that link right here. And then next, we have hypothermia and frostbites. Wait, I sent that out last month. I'm going to keep that live for everyone to review. If you haven't done so yet, please do so. We have a lot of hypothermia and frostbite education that's been released recently, but it's very timely, very important because we are seeing it. We've actually had some cases of it. So make sure you click this link, review that sway. It's got a lot of good information on there. It's really brief. And then some things that we are working on. So not really much has changed here from last month. We are still working on our full education across the system. We are making some headway on that. We are working on that ULearn that's going to be released soonish to you guys. OB emergency education, we are making a lot of progress on that. We have completed, for the most part, our OB hypertension section of it. We're going to be jumping onto our OB hemorrhage section of that. So be on the lookout for ULearn on that eventually. And we are still waiting on our ESI education work group to resume. We've had a lot of barriers with that, so just bear with us. We're gonna get some ESI streamlining going on for you guys as well. And then a new thing that we are working on is we are revamping our mock code champion program. We used to call it mock code trainer. We are transitioning to new terminology here, mock code champion. So we have our mock code champion for LPH, it is Armando, and then for BFH, it is Kelly. If you are interested in doing that, it's a very low effort thing. There's not much you have to do. So if you are interested in becoming a mock code champion, please reach out to me. We are really solidifying this program. It's been very clunky and kind of lackluster, but we are revamping it. We are improving it. So be on the lookout for that. This is something that we are really putting some passion into. And then education requests. So this is the last slide. This is as every month. If you have any specific education requests, please let me know, and I highlight specific. Make sure they're not broad, because if they're broad topics, it's really hard to touch on the things that you really want to hear about, and it's going to probably give you some very superficial information. So make sure they're specific, and please send them my way. Otherwise, I hope you guys have a great holiday, and you will hear back from me on the education updates next month. Take care, guys.